So we currently have a few people joining us, so I will start. Hi, everyone. Thank you for joining us. If you could please introduce yourself in the chat, that would be great. Today, we're going to be talking about organizational restructure to promote BIPOC employees' well-being. We have Dr. Regina Wilson, Misuse Ranking, presenting with us today, and we have Daryl McGraw moderating today's event. I'll be handing things off to Daryl shortly. I'm just going to go over a few housekeeping information. If my screen goes, here you go. So housekeeping information, participant microphones will be muted at entry. We can unmute them at any point. So just let us know if you have any questions that you'd like to speak up, or if you have any questions for our presenters. We also have the chat if you would like to put that in there and introduce yourself as well. This session is being recorded and it will be available on our website tomorrow. We'll be emailing all of the registrants with that information. And if you do have any questions after today's session, you can always email us at newengland@mhttcnetwork.org. This is just a disclaimer that the New England MHTTC is funded by SAMHSA, and this presentation is being recorded and will be posted on our website. And the MHTTC network uses affirming, respectful, and recovery-oriented language in all of our activities. So with that, I will hand it off to Daryl.
Thank you, Vanessa. Thank you so much, and welcome everyone. Welcome. I see some people in the chat. I see some people in the chat, and people keep coming in, and feel free to introduce yourselves in the chat. Good afternoon. I'm excited about this conversation. We're going to jump right into introductions. And I use first names. Pronouns, if I missed something, let me know, but I will start with Regina. How are you? How's it going today?
I'm good. How's everyone doing?
Great.
My name is Dr. Regina Wilson, and I am a licensed clinical psychologist. I have a private practice named Wilson Mental Health Services in the Hartford area. I've been in private practice for over 20 plus years, and I've worked with trauma, domestic violence, child sexual abuse, emotional issues. I do the gamut of things. I also am, which I'm representing today, the vice president of the CT BIPOC Mental Health and Wellness Initiative, which we started in 2020. And so, and I am also a certified second level Reiki healer.
Oh, awesome. Thank you. It's a pleasure to have you here at this robust conversation with Cheese. How you doing?
Good, Daryl. How are you today?
Good. I'm ready to jump in. Let's go.
Let me just introduce myself to everyone. Hi, my name is Misuse Rankin. I am a #1 person in long-term recovery from alcohol use disorder. I'm a former law enforcement officer. I was a correctional officer for 13 years here in Rhode Island. I'm currently serving with Rhode Island Communities for Addiction and Recovery Efforts as the chairman of their advocacy committee, the community engagement coordinator, and an outreach specialist. And I'm happy to be here with you guys today.
Awesome. Thank you so much. So I'm gonna just do a quick introduction to myself. My name is Daryl McGraw. I work for C4 Innovations. I'm the senior manager of racial justice and equity. I'm also a person in long-term recovery from substance use, as well as PTSD, 10 years of incarceration. So geez, we've both been in the joint, if you will, right? So spent 10 years of my life in and out of prison system on an installment plan, personal long-term recovery. So that means I haven't used a substance since May 7th, 2007. And I'm just excited to be here and be a moderator of this great conversation. We got some questions, but let's just, this is going to be us. We talking, we're just getting, I'm going to throw some stuff out there, but then I want you to add and chime in. I moderate a little differently. So this is really just us having a conversation. And let me just start with, as direct service providers, what are some of the things that people who you serve express to you? Like, what are some of the things people that you work with, that you've worked with in past or present, what are they expressing to you about this topic? What you guys got?
I didn't hear that last part you said about
in reference to our topic today, like what have you heard people say to you? What have they, as you know, providing direct service, people of color, what have they said to you? Like what brings this? What is the street? I always say, what's the street saying? What are they saying on the street to you? You know?
Well, I don't know if you mind me go first. I know, speaking in terms of how CT BIPOC came about was in the 2020 when the pandemic started. Janelle, I can't remember, Janelle Posey Green, who was actually who birthed it, because she was getting a lot of questions or asking for support around the pandemic, but also all of the racist acts that were going on, the police brutality and acts of racism, and people were looking for resources and support. And so she gathered together a bunch of us professionals to provide this forum where people could get educated, can find resources, and get help. There's been such an increase in anxiety and depression related to the pandemic, but also related to the racism and the police brutality that's been going on. So I think people are seeking answers and seeking help,
Right.
and yet they're also stressed. And then the pandemic has caused such a problem in terms of my population is lower SES.
Okay.
So people are struggling to make their needs, pay bills, have their basic needs met. So I think a lot of, and self-care is not on the forefront for people. It's, I got to take care of this stuff. And a lot of times with my clients in private practice, like there's other things I got to address even before I can get to the trauma. Like it's not going to do, we can't go forward addressing their personal stuff without addressing the physical stuff. So that's what I'm seeing a lot of.
No, I really appreciate that. And just so those of you that are here, jump in the chat box. Feel free to throw questions in the chat. We operate like that. And I love what you said about self-care, because, working with different people in different communities, and like you said, socioeconomic statuses, right? Some people say, well, I just go for a jog after work. Well, you know what? There's certain areas you can't jog, right? Maybe there's no sidewalks. Maybe it's a dangerous neighborhood. So jogging might not be something that they can do. So we gotta, when we're working with different populations, especially Black and Brown, and people that are from different socioeconomic backgrounds and communities, we gotta be able to, like what we always say, meet them where they're at, right? Meet them where they're at. So when you offer self-care ideas, it can't be suburban self-care ideas for urban cat. Does that make sense? I'm old school, so I say cat. Machis, get in this conversation. Let's go.
Yes, sir. So one of the things that we're seeing, my organization does outreach with people who are in active addiction, early recovery, long-term recovery. And one of the things that we see, number one, is there's been this kind of narrative that COVID was the thing that spiked overdoses. Overdoses were already on the rise, right? You look at the data and you can see there's an uptick in overdoses. And again, primarily impacted by that are people that look like us. So there was already this uptick, and then the pandemic strikes and everyone says, oh my God, it's the pandemic that's causing these overdoses. No, we were already dying. It's nice to kind of try and make it seem like there was something else at play, but it really was, there was something else at play prior to this, right? So we go through the notion of, all right, we're going to engage people, we're going to talk about treatment, we're going to get them into treatment, we're going to educate them about the resources. There's no bed space. So I come to you, I'm a person in addiction, I want to go into treatment, I want to be taken to a place where I can start that journey, and then I don't have anywhere to put my head because the places are all underfunded. So it's like these programs are being set up, and organizations like mine will say, okay, we maybe need a space of, say, X amount of, thousands of square feet. We need 30 people, and we need, say, roughly, like $200,000. We get a place that's a few hundred square feet. We get a staff of like 8 people, and we get $50,000. And so by the metrics that are required of us to show success, we fail miserably because we're not given the resources to be successful when we've expressed what we need to be successful. So it's kind of like we're already starting off behind the line and being expected to win the race.
Right. Dr. Virginia, you want to chime in on that? You want to go on that? Because we could build on that, because we could talk about that more, because we talk about a lot of times the people that we always talk about the impacted people, right? We talk about the people that are closest to the solution, are closest to the problem, but yet furthest away from the resources, right? And I think that's what Matisse is saying, right? Furthest away from the resources. So what can improve these? What can improve in you, either one of your opinions, these services? Like, how do we connect? Because we got some conversation to do. We could talk about criminal justice, we talk about the policing, a lot of these things, but let's stick with the service piece for right now. What, in your eyes, what would improve these services?
I mean, I think what we're trying to do is, we do these forums. We offer, we're doing like 4 forums a month. And we do them, they're free of charge, right?
Okay.
So anyone can sign on to it. We try to find topics that are relevant to our community. We've done over, Vanessa, can you put up the slide of the forums we've done?
I'm gonna bring those slides up for you real quick. Cool, there we go.
We're gonna, okay. So let me just, okay, keep going down one more. Keep going. Right there. So these are some sample forms that we've done, right? We as professionals, kind of like, we've been attuned to listen to what people are saying they want, what they need and what they want.
Right.
And some things that we also think maybe would be relevant for people. And so this is the opportunity for, and we also talk about alternative holistic healing, because like there's sound healing. People may not be aware of sound healing. We talk about using herbs. We talk about, like matter of fact, tomorrow, Friday the 30th, we're talking about using herbs and teas as healing. Wow. So there are other ways that you can do, but I think the important piece is trying to educate people. Like one of the big things we did also was demystifying, talking about medical mistrust and the COVID. And we literally went through and we talked about what our understanding of what was going to be in the vaccine. And then we talked about how, the mistrust because of like the Tuskegee, Henrietta Lacks, again, we understand these things and we're not telling people what to do. We just want to educate them so they can make an informed decision. Right. So that's part of what we are doing. We also are branching into trying to do trainings. We're going to be working with Fairfield school system on doing training on racism. We've done a training with Crawford Law Associates where we talked about self-care, because lawyers do not do self-care. They work. It's not in the forefront of their mind. But I think that's the piece there is what we're providing to people where maybe they're not comfortable. Our people are not comfortable with the mental health field. Right. We don't talk about our problems. You don't go talk to someone about our problems, especially when the majority of people that do counseling don't look like us. Right. I'm one person that, like, for the longest time, I would get a lot of referrals, when I used to do my child sexual abuse, because there weren't many African-American women doing sexual abuse work. There's more people, but the numbers are still far less. So again, we just want to be able to reach people so that they can learn about, anxiety and depression, we talked about the medications for it, like how we specifically, when we had a doctor come on here, and she talked specifically how it affected the brain, and what they did. So I think this is one of the ways we can reach. We talked about recovery. We have a wonderful, and you're familiar with Kelvin, Kelvin Young.
Yeah, that's my guy. Yep.
But we're open to whatever people are seeking to have more understanding on. We try to do it.
Right. It almost sounds like what you're talking about is outside of the box, right? Outside of the norm, what people really, because Kelvin, like you said, Kelvin is a good friend of mine and he does sound healing. And, this is not something that people are accustomed to, but maybe in certain communities, but not in urban communities. And he's really been the person that brings that culture, that to these urban communities as well. And I think that's sometimes like what you're doing. I commend you on the work that you're doing to educating people, right? And educating communities, because you don't know what you don't know, right? Chief, you want to bring us in on some of the stuff that, I want to talk about, like, because, it's interesting. Actually, Kelvin and I, I don't think you'd have a problem with me sharing, but we both share that corrections background, right? So we both found this our path through the Department of Corrections. So with having that corrections background, how do you show? We're going to leave your slides up because we're going to bounce back and forth to them as well. But having that corrections background, Machis, how do you see this, the work that you do? Where do you see that? Because I got to say this is my new thing. I got to say it. You know, at C4, this is what we believe is that reentry begins at the beginning of the sentence and not the end. This is important that every time we talk about reentry and we talk about people in returning to communities and anyway working with that population, we need to have people understand that reentry begins at the beginning of the sentence and not the end. We cannot wait 60 days before somebody comes back to the community, and we need to be addressing those issues, especially trauma and all these other things that we're affected with when we go inside, right? We don't talk enough about ACEs and stuff. Don't get me started, man, right? So we don't talk enough about that. So how do we make sure that we're engaging those people at the front end? So when they come back to the community and engage with Regina and other people, right? Community service providers, they are equipped with at least some knowledge of at least where you're at, right? At least let us know where you're at so we can come to you. So Machis, what you got, brother?
Well, let me take it back to where you
Absolutely.
put it in ACEs, right? So for those who aren't aware, ACEs are adverse childhood experiences, right?
Yep.
So we're not trying to get at the guy when he's an adult walking into a correctional facility. We have to stop that little boy who's going home to a house that the lights might not be on, or to an apartment where his caregiver may not be there, or to an apartment where her apartment may not be her apartment anymore, right? Because a child who's struggling with food insecurity and a living arrangement that's shaky and all these other things, and I mean, you know, like Dr. Wilson brought up, sexual abuse and all these other things, those are a multitude of factors that play into a child being diagnosed by someone who doesn't have the skill set to make a diagnosis of them. So now they get put into that prison pipeline at school. It starts in the school where, you know, Billy has a problem, Billy talks back. Well, you don't realize Billy went to bed at 4 o'clock in the morning because in the place that he lives, there's loud music, there's all kinds of stuff going on, and he doesn't get an opportunity to go to bed. Or Billy's the caregiver because his mom is working 3 jobs to try and keep a roof over their head. So we need to be working to try and address that before that little boy becomes a young man and starts being out on the streets where he's trying to help his mom or his dad or his grandmother support his siblings or her siblings and move through, right? So in the prison piece, I mean, number one, I think we all know that in all of law enforcement, the people who wear badges don't often look like us, right? And for anyone who wants to express that law enforcement isn't a racist environment is kidding themselves, right? You give a lot of people who don't have a particularly high amount of education a lot of power and dominion over others and not a whole lot of oversight or accountability, right? So you take a person who's already had a very difficult upbringing. And this isn't to say that, you know, everybody who's in prison has never been given enough hugs. It's the facts, it's the reality, okay? So you take a young man who's known nothing but, or primarily fighting for everything that he needs. You put him in an environment where he now has to continue to fight for everything that he needs, right? Now, I'm a big comic book fan, so I'm big on Superman. And in Superman's world, in the DC universe, when Kryptonians had a problem with a person, they put him in the Phantom Zone, right? So they put him in this place that they'd never come back from. It was a dimension that they could just beam you, you're gone. You're never coming back. Well, our prison system isn't like that, right? We don't beam you away to another dimension where we never see you again. You're supposed to be there for a finite time, and wait for it, you're supposed to be rehabilitated, right? And you're supposed to have an opportunity to re-enter society as a productive member of society, having paid your debt. Now, when you pay your debt, you're not supposed to keep paying. So when we get people into prison, are we providing any care for them? Are we providing any kind of skills for them to really address what has happened in their childhood? When I worked at the state prison here in Rhode Island, there were a lot of guys who would experience sexual abuse when they were kids. And so they were acting out. Their violent behavior wasn't necessarily part of their true makeup. It was, they were fighting the demons of things that had been done to them when they were kids. And nobody was there to say, you did nothing wrong.
But Chief, let me ask you a good question. That coded word rehabilitate though, what does that actually mean in terms of the prison system? Because that's the whole crux of it. Like what rehabilitate for me means entirely different than I think what it means in the correction system.
Right. It's like treatment or recovery, right? It's different for everybody. So my idea of rehabilitation
What's
is,
your idea what the Department of Corrections idea is?
oh, listen, the
What's your idea?
Department of Corrections idea of rehabilitation is keep you there until the clock runs out on your time and then put you back out on the street.
That's the problem.
That's it, right? So we would give guys bus passes. So they'd get a bag with their stuff in it and a bus pass. See you later.
Right.
I just spent 6 years sitting around doing nothing but playing cards and, playing ball. What did I learn in that?
Exactly.
Nothing. And you expect me to go out and do something productive, but when I come back, you go, oh, you want to be here. No, I don't. But I don't have any skills to do anything else. And when I'm looking for help on that, you turn me away because you say you're a convicted felon. I can't stay with my family if they live in public housing because I'm a convicted felon. And if I stay with them, they can lose their home too. So they have to turn me away. Right? I can't even become a barber because of my, and I don't have a criminal record. I'm just saying all the guys that I've known that have gotten out and tried to do the right thing have had these doors slammed in their faces. And it's like, what am I supposed to do, man?
Right.
So
That was
yeah,
awesome.
that's
That was awesome. I'm not sure if you guys can see me. I'm feeling like I'm frozen. Am I good? You guys can hear me?
I see you.
Good.
All right, cool. So let's keep it moving. I really appreciate that. Let's talk about, I just want to go to a different question on how do you think recovery and treatment is viewed, right? And I want to be correct and say Dr. Wilson. I might slip and say Regina because we talked before, right? But Dr. Wilson, on the topic of how do you think they review recovery and treatment? How is it reviewed? How do you think it's viewed in the BIPOC community?
Again, I think this gets to this piece where we aren't necessarily seekers of help, right? One, you have a lot of the shame and the stigmatization associated with it. So that's going to keep you from seeking help. I think and also then it ties into coping skills, right? Sometimes, if you don't have good coping skills, you're naturally going to fall back to what works for you. So I think the other big piece of that's really been helpful with recovery, and again, this is not my forte, so I'm speaking a little bit out of my element, but I think that the whole idea of peer support has probably been the most effective and most successful for people in recovery. And I think we need to put more monies or funds into peer support programs because, you connect. Like I know why some of my clients, it works with me is I share a little bit of myself to the extent that it's going to help them. If I have a story that I know that they can relate to, because a lot of times there's this whole thing that like, oh, you got your PhD, you had life easy, all this stuff. You don't understand you don't know my life. You don't know what I've been through. Like, I'm not very different from many of you. So I will share a story to allow people to feel more comfortable, that they can relate to. And I think with recovery, I think one is we have to really, like I was just saying, we have to remove the stigma of it, right? People have their struggles for whatever reason. A lot of it is, in my experience also is with women. I find with women, a lot of their substance issues are tied into their trauma and lack of being able to express themselves. And so they're feeling, right? So we really got to get back to, like Matisse was saying, is, it's not about going back, telling your stories about what happened, but talking about how that made you feel, and, I just recently became certified in training EMDR, which is amazing to do. You're not reprocessing trauma, but you're just trying to understand the negative cognitions that you develop from that, work with those, institute healthy, positive belief, right? Put resources and support around them to help them survive, when I worked at the state hospital, because I did a stint at the Cedar Crest, it's no longer in existence, and I was on the dual diagnosis unit. One of the biggest things that I used to see was, people come in here, they get clean, and then when they go right back out there, they use, and they don't realize you can't use at the same rate. You will die. I don't know how many people I had heard about overdosing, right? And even though it was a psychiatric hospital, you know, we could have did better in giving people skills so that when they went back out there. So I think we lost Daryl. But Chief, what are your thoughts on that question that Daryl presented?
I think I just want to co-sign on what you said about peer support, because there's something to be said for talking to somebody who's lived or shared a similar experience to you, right? When veterans are talking about issues that they experience, they want to talk to people who shed blood in the same kind of mud, right? They don't want to talk to somebody who's been stateside when, you know, and telling them what it was like. It's like, no, you don't know unless the bullets are flying at you, right? You can watch all the movies, but it's not real until you're there. And I think with peer work, especially when you're sharing, when you're listening, like going back to the, you know, the notion of what I did as a correctional officer, I didn't have to care what was going on in a person's life. I could go into work, I could punch in, I could punch out, and I didn't have to care or involve myself in what was taking place in a person's life. As a peer, as a person who's supporting people in peer work, I have to engage them. I have to care. I have to sometimes re-traumatize myself in that space. Because like you were saying, I'm Machisti Rankin. I'm a former correctional officer. People think, oh, you used to work in the prison, so you're one of those guys. You don't know my life. You guys know my life because we've spoken with each other. So for the people who don't know, they don't know that I have a brother who died of an overdose. They don't know that I have a brother who was incarcerated and was murdered on the street. You know, they don't know about, you know, different aspects of my life that I've experienced, that I've suffered through, the multiple deaths that I drank my way through. Because I wasn't a weak Black man. I was a strong Black man, and I wasn't going to go to somebody and cry and say that I needed help. And in all actuality, I really was crying inside and needed help and was too proud and too foolish to not ask for it. I always liken it to lifting a heavy couch. If that couch is too heavy to get up the stairs by yourself, do you just stand in the hallway with the couch pressing against you, or do you ask for help?
No, that is powerful. I was kicked out for a minute. Y'all wasn't letting me in back into the club, but I'm glad y'all kept the conversation going. I appreciate it. And you know, I think that says a lot, right? Jason, you know, something that you said was very powerful, but understanding that everybody's situation is different, right? So maybe they don't have like, and I don't like to use the word resilience because someone told me something about that the other day and it kind of stuck with me, meaning like, you know, well, if you did it, then how come the other person can't? And we cannot put people in that boat, right? We got to be able to say that we honestly meet people where they're at, and you know, and we try to help them on their journey. My journey is different from yours, and each right. And Dr. Wilson, I see you about to chime in. Jump in. Feel free.
I was going to say that my view of resiliency is a continuum, right?
Yeah.
There are some of us that are on the higher end that have the skills, and there's some of us on the lower end, but you can build resiliency, right? It's like a muscle. You build. It's what I was learning about. You build it. You teach it. You teach people to be. Maybe you didn't know that instead of using the drink, you can go talk to someone, right?
Right.
So you can build resiliency. It's not like people say nature versus nurture. It's not all or none. Teach it.
Right.
Teach it to people.
I love the quote in the chat. My homegirl Vanessa said, "We're all in the same storm, not the same boat." Man, I got to borrow that, right? Because it's true. Like, you know, we're all like, you know, and I'm going to use this because we talked about ACEs a little bit. Can I talk about a little trauma, as we talking, right? So I grew up in the hood, right? So I grew up in an environment and my dad left, right? And that was a traumatic experience for me, right? But my brother grew up in the same house. He didn't end up in prison. He didn't end up having a substance use issue. I did. So, and then many others seen the violence, and all of us, and not all of us had the same experience. So our response to that trauma or the traumas that we experiences weren't the same. How do we educate people understanding? Because they're like, well, I don't understand why it kills me when people say, well, you don't look sick, right? You don't look like you have a problem. I don't understand why you couldn't do it. Right. And so how do we educate not only outsiders, but insiders of our own community, how trauma may show up? Talk to me, man.
I mean, well, first of all, the first thing we gotta move away from that whole rugged individualism.
Yeah.
Good point.
Okay, let's go.
Because that's not that is for me, that's that white narrative, right? We're not all built that way. Trauma can show up like, so I'm gonna tell you, I'm one of 6 kids.
Right.
And I always get amazed how, like, you can talk to each one of us. Well, I've lost 2 brothers, but you could have talked to each one of us, and we all have experience of what happened in that home. Like, I just get amazed how, like you were there, right? You were there. We same mother and father, right?
Right.
And it's different. But it's also, the thing that plays in there also is protective factors. So, like, I'm the only one of my family that went to college out of the 6 of us. I had a couple other brothers that were smart, but didn't have the financial means to do it. But my intelligence was a protective factor for me. I was always put into programs that would allow me to then go ahead and excel. So that's one key thing when you have that. But I mean, I grew up witnessing domestic violence. Like, I'm gonna tell you honestly, I didn't know my family was dysfunctional until I took social psychology in school.
Right. All right.
Wow, now I understand. Like, I honestly thought some of the craziness was normal because I didn't have no other viewpoint, and many of the other families around me had similar behavioral patterns. So I'm desensitized to violence and trauma because this is what we're all experiencing. So now, one of my clients had called me last week, and she was like concerned because her daughter was, she has a 2-year-old daughter, and she was inappropriately touching herself only at the shower. And I said, okay, before you go into panic, let me tell you what are some of the signs of child sexual abuse, right? So I'm like, if she's doing this excessively, then you get concerned. If she starts doing it with her brother, then you get concerned. If she's engaging it with an adult, then you get concerned. But right now, it is normal. You got to teach them what is normal behaviors, and then what is abnormal behaviors, so that they can know what it is. And so, like, I talked to her about what are the different signs for sexual abuse, and it relieved her. But trauma can trauma can show up in different ways. I had one kid one time who she was just fondled, and it was the worst thing in the world. It's, again, how you interpret, where I've had kids who've been multiply victimized and they weren't not as affected as that one child was. It also matters of how people validate and respond to you. You can go through a lot of trauma, and yet you've had the support and the validation, which we also know that increases how well you do, your success rate for healing, right? So with little kids, again, I tell parents, you're the expert on your child. You see your child day in and day out. If you see them start acting differently, right? You see an increase in aggression. Doesn't mean something is going on, but pay attention to it and try to find out where that aggression is coming from. Right. You see your child's normally outgoing and active. They're now withdrawn. Something is going on. Explore what's going on. Try to talk to them. Right. Sit down and ask them questions. If you're not comfortable with it, send them to the professional. Don't send them to someone who is not trauma informed, right? Because then they're gonna be like, oh well, the behavior looks normal. Send them to someone trauma informed.
Now, with that saying that, Dr. Wilson, I didn't mean to interrupt you, but I want to say, how much does culture play into that? Right now, you're going to send them to someone that's trauma informed, and we're talking about culture, and we're talking about BIPOC communities, right? Is it important for that individual? Because we all know now, let's keep it real, how a house is run. Like you said, I myself didn't know I was a survivor of trauma until we started doing this work. So if you don't understand a certain culture or cultural norms, and then you're treating this individual, but not from that environment or not familiar with that culture, how much is culture important? I'm curious when we're talking about treatment. And Chief, you're going to jump in here because this is why we're here.
I'm kind of listening to Dr. Wilson and just taking it in, but I feel like culture plays a huge role in that.
Right.
I mean, as a community.
Hold on, brother. I asked Dr. Wilson first. Okay. Now we go. I got you.
I'm sorry.
Switch back to her. Right. And then let's go. Let's get it.
So culture is important to a certain extent.
Okay.
There are going to be some people who are only going to be comfortable with working with someone that look like them.
Right.
You have to remember, within that, just because I look like you, I could have grew up in the suburbs. So I am not understanding you completely because my values are of a middle class suburban value.
Okay.
That's one component. The other piece with culture, you can have people who are culturally competent, right? So they actually have sought out trainings,
Right.
they've been into the community, they interact, and so they are culturally competent.
Okay.
To work with people. An organization, you look at what their values are, right? If they're anti-racist, if they're operating from a cultural blind perspective, you don't want to go there because they're ignoring culture. Culture does matter. So again, it depends on the individual and what they're looking for.
Right. I love that you say that. You know, and an interesting thing, because you work in Hartford, we're both in Connecticut. A lot of times we don't have a lot of choice on where we end up receiving services, whether it be economics or providers, you know, what providers are close to, like transportation, all those things play into factors, right? So sometimes choice is not, which is something we talk about a lot. Like certain people, depending on who you are and what your economic status is, you get to pick and choose where you want to go for treatment. Whereas other people that may be less fortunate, right, are only, this is where you go. You don't pick the doctor. It's whoever's the doctor on duty that day, right? And those things play into that. And that's why I asked about the culture piece. But Chief, jump in real quick. I know you have something. Let's go.
I was going to say the National Institute of Substance Abuse talked about socioeconomic factors as barriers to accessing treatment. They didn't speak about race. And the reality is race plays a role, right? Like what you're just talking about, you know, being able to pick and choose. I mean, we don't really, in a lot of communities, people don't have an ability to choose where they buy their food from, right? You can go in some communities and find 12 liquor stores in a 2-block radius, but you have to take 6 buses to get to the nearest supermarket that can give you fresh fruit. So I think that education and access are huge things, and it's teaching people where to access these things and to get the best quality, because just because something's free doesn't necessarily mean it's good. And just because something's expensive doesn't mean it's good either, but it's finding those places, you know, like Dr. Wilson was saying about, you know, cultural competency and all those things. Yes, there are a lot of people who, just because you're Black, aren't necessarily on the same page. I mean, got a lot of Black Republicans. Go figure.
Whoa.
You know?
Yeah, right. Now, you know, then there's a saying in the old school people in the community used to say, just because you're brown, that doesn't mean you're down. Right? We got that.
Not all skin folk is kinfolk.
Okay.
Kinfolk.
Let's be clear. Because we want, you know, this is being recorded. We want people to make sure that, you know, we understand that we're talking real, right? And let's get back to, like, you know, because this is it's an interesting topic, because a lot of times, you know, we do these forums and people say, well, we're having a very difficult time engaging the BIPOC community. For one reason or another, they don't engage, they don't do this, they don't do that. And is it, what do you think the difficulty is? Where do you think that difficulty is coming in at? Talk to me.
I would say from what I experience is most of the organizations in Rhode Island don't particularly have a large footprint of people that are members of the BIPOC community.
Okay.
You know, and I think that, you know, one of the things that we touched on earlier was stigma, and we have to do a better job within our communities of letting people know there's no shame in having had an addiction or having that addiction. Life kicks you in the butt sometimes, and it kicks you real hard. You know, it's not a judgment on resiliency, cowardice, any of the negative terms that can be thrown out there, or positive terms that can be thrown out there. It's just that everyone's impacted differently. And if you reach out, someone should be there to grab your hand.
Right.
And we don't have a lot of that in our community.
Well, so you're saying about outreach. Dr. Wilson, you do a lot of outreach. How do you engage these communities? How do you get those people to those forums that you're doing over there at your shop? How do you do it?
I mean, so we right now mainly stream through Facebook. And so Facebook, word of mouth. I mean, I think we've reached over like 45,000 people just through
Right.
Facebook alone.
Okay.
You know, I want to the question. I want to just answer the question in a second. Why is it hard to, you know,
Yeah.
engage our people?
Talk to me.
I think sometimes there also is fear.
Mm-hmm.
Fear around if I do share some of the stuff that's going on, I'm going to lose my kids.
Yep. Yep.
No, I want help, but I'm scared to seek help.
Oh man, Steve. Yep.
There's the other piece that like 8 to 5 does not work for everybody, right? I'm working. You know, your office is only open 8 to 5. You don't all have any weekend appointment times. I mean, for me, we're doing telehealth, and so that's been kind of good because ordinarily I'm stopping at, and I'm not gonna lie, I'm stopping at 5 o'clock because I want to get home and this that. But now that I'm working from home, I've added in appointments 5, 6, and 7. You know, I'm willing to, if I need to see someone on a Saturday, you know, I'm willing to do that. You know, but we have to be more flexible.
Okay.
With our people, you know, going out into the community, right? Using spaces that are in the community that are available, that where people also feel comfortable with.
Right.
You know, I'm located in an area of Hartford that is on the bus line, so we're accessible. It's a comfortable area for people. So yeah, I think you just got to be, I think, flexibility, desensitizing people to mental health issues, being willing to use yourself, talking about, like, you know, that you maybe have struggled with a mental health issue. And I think the other thing I always tell people, because the first thing people want to tell me is I'm not crazy. I'm like, well, that's good because I don't treat crazy people, you know.
Right.
What mental health just refers to is the mind. And it means that your mind is not working right, whether, you know, you're feeling anxious. And so we need to give you some skills to help you with your anxiety, you know, or if you're depressed, how to figure out, you know, how to lift your depression. What can you do to help with that? That's all mental health refers to. But again, like, education is a key.
Right. And I really appreciate this conversation, because what we really want people to do, like, you know, so many times people say, I just watched your video, and I want them to really understand that, yeah, we're not a difficult community to engage, but you're going to have to do the work, right? You might have to go to that faith-based organization. When we were talking about COVID and we were talking about COVID injections, I was like, you know, you talk to the pastor first and tell him, you got to explain to him what this vaccine is. And then he will let you talk to the masses, maybe in his congregation. But, you know, and I talked to someone, they said, you know what, once they educated our pastor, then the pastor came and said, look, I'm gonna let these people, he didn't tell you what the vaccination was. He said, I'm gonna let these people into our house and talk about the vaccination. And that's how people, and they still, the choice was what? Still up to them. So you gotta, you know, we talk about coming into these BIPOC communities and building trust. Number one thing you gotta do right off the top is establish trust, right? Whether it be corrections, whether it be Black, come on, y'all know what I'm talking about. I'm getting chills just thinking about it. Because if you don't build trust, you don't got nothing. Talk to me.
Also, besides trust, you have to have respect.
Oh, yeah.
So like, yes, I'm a PhDer, but I don't try to act like I'm more superior, right?
Right.
You know, they, independent of whatever your life path has been, you're still a human being. Right?
Absolutely.
When you talk above people, especially in our community,
yeah,
no, you're insulting them. You gotta talk with people,
right.
Not at people or above them.
Right,
you have to be relational.
Yes.
Right?
Some of my friends don't want to talk to me because they say I start talking way, you know, I'm trying to say, you know, if we aim the dilithium crystals and we do this, they be like, whoa. They be like, you know, he went to college, right? And they don't want to. But so, Matisse, check this out. You coming from the correction side, even with your lived experience, right? How did you establish and build trust with our people? Because you're the police, for a lack of a better term, right?
Well, I was Machisti before I was Machisti, the correctional officer.
Okay.
Right? So my credibility I would say it's transcendent.
Right,
people knew me before I put on a badge. People knew me when I had a badge, and people know me after I had a badge. The same dudes that I used to run the streets with and get high with and get into trouble with were the same dudes that knew me when I put a badge on and stepped away from that life as I had to, you know, but I still had the same friends. People know me. I'm authentic. I'm real. And so the trust that I have is trust that I built up over years of being out with people, playing football, running track, running the streets, having brothers that were involved in different stuff. Like I said, my brother was incarcerated up until he was murdered. My other brother was a deputy sheriff, but he had a lot of friends that he went out and, we're Black men that grew up in the inner city.
Right.
And, there before the grace of God go a lot of us.
Okay.
So some of us are able to, dodge those different opportunities or to get into trouble. And others of us aren't so lucky.
Right.
So, for me, it's just knowing people and having them know me. I'm just the dude that they went to junior high school with, played ball with, did whatever, smoked a few joints with, whatever.
Okay. Now I want to shift gears. A little bit, right? Self-care. We talked about it in the beginning, but we got to bring it back because a lot of people struggle with it. Not only professionals, Black and brown professionals, but also the people that we're talking about in our communities. So I would like to shift gears. Dr. Wilson, give me a little self-care or as much as you want on the self-care piece and how do you offer it, teach it, but also yourself, if you want to chime in. And Matisse, think about it because I'm gonna come right to you and we'll talk about self-care because that's super important, especially with COVID and all the trauma that we're seeing. I mean, we had, COVID, then we had racism,
No, we have racism. And then we had
No, I was going to, y'all didn't even let me finish. I was going to say it was elevated.
Okay.
I was going to say we had the elevated piece of racism. It just got up the ante a little bit. It came a little bit more intense. At least it was turned. They turned it up a little bit more because now it's visual. Now you're seeing it and you're seeing things that I'm not going to the Capitol raising my voice. I'm not even going to the Capitol raising my voice, much less storming it. And then you see it, and then you see it almost being swept under the rug. That is traumatizing. So, y'all know what I'm talking about. Don't try to put me out there right there, girl. I'm the moderator, but I'm trying to work with y'all. No, come on, let's go self-care. Let's go.
Man. So self-care has many ways. I mean, the important thing with self-care is that you incorporate it in on a daily basis. Because when you have it on a daily basis, those days where it's super hard, you're going to go ahead and do it, right? Mm-hmm. The other days it's just maintenance. So I'm talking about me. So I'm 54. When I turned 50, I had decided that, I want to work, but I don't want to be a slave to work. Mm. Me was important. So I decided that that's when I learned about sound healing. And I started going to do monthly sound healings. I went and did my Reiki. I did the 2 levels for Reiki. Okay. And so now I do self-Reiki on me. So I have a ritual where I like to start my day with, where I'm doing some affirmations, get my day, get my vibration right, be on a positive tip, do the self-Reiki for me, which I feel like I'm centering myself. Mm-hmm. And I find when I do those things, and I don't do it every day. Sometimes it's like, if it's rush morning, I'm centered for the day. So if something happens, I'm better able to manage it. I also listen to my body. You have to listen to your body, because if you are having like emotional, psychological stuff going on that you're not addressing, it will come out physically, right? Mm. So like you're feeling overwhelmed about something you're not addressing. You now have a headache. Your stomach's acting up. Mm-hmm. But if you had to address what was going on or kind of do some self-care, that could have been prevented. Long-term use, I had this one client, she was, when I started working with her, I asked her a question, what was your worth? And she was like, and she literally was trying to find a monetary amount. Mm. And she finally figured out what I was asking is basically how you feel about yourself. Wow. Do you know you're good enough? Do you know you're enough? And she was one of those type ones that she kind of felt like she had to prove herself, and she would go. 60 years later, she's got this back problem because she wasn't taking time for self. If you don't take time for self, the universe will. Mm. I love to take baths. I mean, I get the Epsom salt, I get the essential oil, put it in the tub. I got the candles, I'm lighting my incense. And I'm just like relaxing myself, because I know the less I'm available to me emotionally, then I'm less available to my clients. right? And I want to give my clients all I can give, because I mean the work is already draining. You know, the need has increased so much that if I don't engage in self-care of some type on a daily basis, sometimes for me it could just be vegging on. I'm a TikTok junkie. I'm addicted to TikTok, y'all. I need treats.
Yeah, me too. I watch it too. But I was going to say, you made me a little nervous when you started talking about the bath. I wasn't sure how far you was going to go. I was going to say this is a family show. Keep it, keep it right. Keep it right.
I was just telling you what I do with it.
All right. Matisse, come on, man. Where we going with it?
With recovery community organizations, we wear a bunch of hats. I mean, if you're familiar with the old Bugs Bunny cartoon where the Acme Theatrical Hat Truck Company truck was going up the street and the different hats were falling out and each one that landed on them changed his persona. It's like that in an RCO. You're always, you're working 4 or 5 different jobs and you have 8 titles. And so self-care kind of gets left in the back burner because you're doing direct services, you're dealing with peers, you're engaging people here, there, meetings, everything else. And it's not like, other jobs don't require a lot of you, but sometimes your day starts at 8:30 and ends at 8:30. Mm-hmm. So for me, COVID hit, the gyms closed, all that different stuff. I was involved in athletics for many years. And so for me, physical movement is really important. So I was involved in an exercise program with the CrossFit gym near me, and I got back into it because I had to. And I grew up in the Baptist church, and I'm not as deeply a person of faith in that as I was, because it was kind of forced on me. I really didn't have a choice. So I've gotten into some more Buddhist practices, and I mean, faith is faith, right?
Okay. Man, I really
faith.
Appreciate y'all. You talking Reiki, and I didn't mean to cut you off. I'm just impressed with how vast you're willing to go to seek that self-care, and it's not just like those of us that are in recovery, right? It can't be a joint or a beer. It's not that anymore. It might be sitting by the water. It might be that. We're running close to the 10 minutes. I see LG is.
I just want to say one thing though. I just want to say one thing. I mean, the other side of it is, as when she's saying, you put on the many hats. You can either engage in self-care or you're going to have burnout, right?
Right.
So there's only 2 choices here: take care of self, or self's going to take care of you, and you can't do nothing.
And you have to have the courage to stand up and say, I'm more important than whatever's going on, and I can't be effective if I'm not taking care of myself. So I'm going to give myself some space.
Exactly.
Well, I want to point out this because this was a topic before, and I know we're running. This we could go all day, but it was interesting. I had this conversation with professionals who were talking about self-care, and they were talking about all those things that they go through in the workplace and all the secondary trauma stuff that they hear. But then they come home and whether they turn on the news or whatever, and they're seeing all this. So it's almost like they can't escape. So saying that self-care is important, we got to make sure that our people that are watching understand that you have to do. This is almost imperative that you take some time, whether it be in that room by yourself. You got to figure it out to take some time for yourself, right?
Yeah. You have to provide yourself a bit of an escape hatch. And granted, like you said, you literally can turn on the news and see the world literally on fire.
Right.
And at a certain point, you just reach information overload. You have all this stuff. You got crazy people talking about taking our right to vote away, setting us back to whatever, all this craziness. Fools down in Virginia talking about, whoever won't replace them. And that's their fear, right? And of course, if you have children, they're looking at this stuff and thinking, oh my God, what's going on? Is the world going to be a normal place for us to grow up in? And you just got to be able to kind of shut all that out for a little while, as difficult as it may be, and say, you know what, man, I need to give my mind the space to give me some space. Because if not, there will be no you.
Right. So we got a couple of minutes left. I want to give you the last couple of minutes. What would be our parting words that you would encourage people? Shout your organizations out, shout an event out. This is what we do. This is this forum. This is most important. I think that we should do it again and again and again, because we can never talk enough about how do we embrace these BIPOC communities, because mental health is not something that we go seek. We go other places. Like, I go to somebody said, oh, my friend is my counselor. That your friend is not your therapist. This is not your therapist. That's not there. They might listen to you and they might tell you something. Because I can't count on a couple of my friends. I don't even talk to them about my problems because their view is completely different. So let's give some parting words before we go. This has been a robust conversation. I really appreciate you. You know, even with the tech, you know, this is even with the tech issues, we still was able to get it done. So I really appreciate it. Dr. Wilson, I'll pitch to you. Would you like to go first? And Cheese, you're going to bring us home, and then this is what we're going to do.
So one thing I encourage people is to go on Facebook and like our page, the CT BIPOC Mental Health and Wellness Initiative.
Okay.
That way you can have access, and we have the forms we've done. The videos are up there. You can also go and look at past videos, but go on there, listen to our forums. We also, you know, you can email us. I think it's CT-BIPOC mental health wellness at gmail.com, because we also have 97 professionals that are all BIPOC.
Okay.
We can make referrals and offer resources to.
Say that again. Say that again. Let's go.
So you can email us if you're looking for a specific resource. Thank you. Vanessa put that in the chat room for you.
Chat, yeah.
But I think the important thing I want to say here is, you know, recognize your worth. You're important and you matter, and you need to take care of yourself, you know?
Right. I am good enough, right? I am good enough. The Chiefs, man, let's go.
We, RICARES also has a Facebook page. It's simply RICARES, Rhode Island Communities for Addiction and Recovery Efforts. International Overdose Awareness Day is coming up next month, August 31st. Please show up at an event in your local area. Talk to people about fentanyl and the other analogs that are in drugs. A poison drug supply kills people, and you shouldn't die because you have an addiction. Recovery Month is the month of September, and the Rally for Recovery, we're going to have a rally in Rhode Island on September 18th. Anybody that's in the area that wants to show up and have a good time and just laugh and meet some other people and share your experiences, it'd be great to see people from all over show up.
Yep.
My organization does a lot of anti-stigma training, and as a Black man in recovery, all I can say is that for my brothers and sisters, recognize that it's tough, but it gets better. And Frederick Douglass mentioned that the slave who's a drunk slave is no threat to the slaveholder. The slave who's a sober slave is a threat to the slaveholder.
Wow.
So your sobriety is a passport to true freedom.
Man.
Get on the train. Let's ride.
Let's go. Let's go. I thought you was gonna hit him with "You're not alone" because we're all in this together, right? We all in this together. And you know, I would just want to say I appreciate you both for being here, because we don't have these conversations enough, and it's important for people. Maybe they're not here today to see this video somewhere in our archives. You know, we promote this. You know, at C4 we're promoting this on a constant basis. We're talking about criminal justice reform. We're talking about recovery. We're talking about self-care. For not only for people that are, you know, we're talking about impacted people, all, whether you're a clinician, whether you're a person struggling in early recovery, we are talking to you directly. We want you to know that, you know, we care. Like, you know, we're getting into this criminal justice thing. And, you know, like, once again, remember, re-entry begins at the beginning of the sentence, not the end. And we need to be supporting our brothers and sisters, wherever part of recovery they are in. We need to do that. Once again, I thank you, and I look forward to us chopping it up and chatting again. Thank you so much for your time. And at that point, we're going to end. Thank you. Vanessa, you here?